The COVID-19 pandemic is now the deadliest in American history. The number of deaths, reported deaths in the United States linked to COVID have surpassed 676,000. That is according to the latest tally from Johns Hopkins University. The death toll now exceeds the number of Americans believed to have perished during the Spanish flu pandemic back in 1918. But those sobering numbers come with some promising news in the fight against the coronavirus. Newly released data from Johnson & Johnson shows its single-dose vaccine provides strong protection against serious illness and death even after 6 months. That includes protection from the deadly and highly contagious Delta variant. For more on this, I'd like to bring in Dr. Amesh Adalja. He is an infectious disease expert and a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Doctor, let me just get your reaction to that sobering statistic. The 1918 pandemic and the 2021 or the 2020 coronavirus pandemic. I mean, we're talking about over 100 years ago where medical technology and vaccines were not as common as they are today. Those poor souls who perished in the epidemic of 1918 did not have access to the wonders of medicine that we are privileged to have today. And yet here we are, having surpassed the number of people who died. It just sort of boggles the mind. What's your reaction?
What your take is exactly right, that in 1918, they didn't even know influenza was caused by a virus. They didn't have antivirals, they didn't have antibiotics, they didn't have modern critical care. So our 676,000 deaths with COVID-19 are mostly self-inflicted, and they're really inexcusable because we have so many great tools and have had so many great tools since the beginning of this pandemic. And if you look at the viruses pound for pound, I would say that the 1918 influenza strain is a more dangerous virus than SARS-CoV-2 is. And I think that this really shows that even with something that isn't as virulent as 1918, if you have a lot of human errors compounded on more human errors, plus a lot of reticence by the population to take advantage of some of the tools like our life-saving vaccines, you can really magnify the damage that a virus can do. And I think that's the lesson here, is that this could have been mostly avoidable.
Yeah, and you know, I've read news reports of the era, and it wasn't just the United States, of course, that was affected by that, but it just, the people, there was a psychic scar left on this country and many others after that influenza epidemic, and here, you sometimes it almost feels in some parts of the country as if people are just moving along with their lives and not thinking about those who have been afflicted and those families who have been afflicted. Let's talk about this Johnson & Johnson vaccine. What level of protection does J&J say its single shot can provide after 6 months?
So what we're seeing is differing numbers. In the initial trial, is around 66% of people were protected against any type of infection, but much higher levels against those who would get severe disease. And I think that's, again, what you're seeing now, is that, yes, you have waning, that those numbers can fall, but protection against severe disease seems to be still holding up. It's not as robust as it was early on, which makes sense. And that's why Johnson & Johnson from the very beginning had been studying a 2-dose regimen, which we heard some data on today. That may be something that we see eventually come to fruition. I still think this is a good vaccine. I think that the Johnson & Johnson vaccine had a lot of advantages by being a single-shot vaccine. And I think it still has done its job fairly well. It may just be something that we need to use a 2-dose regimen for, just like the other vaccines by Moderna, Pfizer, and even AstraZeneca, which uses similar technology to the J&J.
J&J is also working on a booster shot. What does the study show about when that could be administered?
So what the study shows is that if you give a second dose, 56 days, I think, was what they used in the trial, post the first dose, you basically have 100% protection against severe disease. And I think that's what many people were looking for. And this is a study that had been planned for some time, that Johnson & Johnson was trying to see, is our vaccine best as a single dose, or do you get an added benefit from a double dose? So now I suspect that data will actually be published. Right now it's kind of by press release, and it becomes a little bit hard to decipher exactly what went on, but they will publish that. The FDA will review that, and I think there may be a discussion about additional doses of the J&J vaccine as well. And I think it's important to use all the vaccines that we have, and I think the J&J vaccine has been underutilized in this country, and it still has advantages even if it's a 2-dose regimen, because it doesn't have those really onerous storage requirements. So it could be given very easily. You can take this out to people to give them.
And doctor, just remind me and our viewers, because I've gotten a lot of questions about this. If you receive, for example, a Johnson & Johnson vaccine, can you receive the Pfizer booster, or should you wait for the vaccine that you received to offer a booster?
Right now, it's going to be based upon what you receive because they're looking at the data specifically to each vaccines. There are other studies going on with mixing and matching, which may provide a better benefit, but they're not really ready for prime time yet. I think that there's more details that need to be worked out. That may eventually be what people will be recommended to do. But right now, it's really sticking to what brand you got, unless there's some kind of extraordinary circumstance where you can't find that brand. But the Pfizer vaccine is very available. The Moderna vaccine is very available in the United States. And this booster discussion is going to continue this week, and we'll probably get more information after the CDC ACIP committee meets and discusses what happened last week and all of the data that's out there.
Well, because the other reason I asked that question, doctor, is this is probably the first time that I can remember that people are actually aware of who manufactures the vaccines that they receive. When we go into our local pharmacies and receive our flu shots every year, no one says, well, who's making this one? And so I'm guessing that, and you tell me if I'm wrong, that the flu vaccines that are available to all of us every year are manufactured by different pharmaceutical companies, or are they all the same?
No, they are manufactured by different companies. There are several different manufacturers, several different technologies for flu vaccines. And I think it would be good if people had their favorites because there's different technologies. For example, we give different flu vaccines to older individuals. We've got a nasal spray that we can give to younger individuals. And then there are flu vaccines that are made in cell technology instead of the chicken eggs, which are probably better. So I'm kind of one of those nerdy people who does ask to make sure I'm getting the brand that I want because I know all of those vaccines. But I think this is something that we probably should think about, is trying to come up with more differential recommendations for flu vaccines. But right now, the priority with flu vaccines has just been getting shots into arms, no matter what shot they are. But there is some differences between those companies and the clinical data behind them. But it's not something that the general public really keeps track of, other than the nasal spray or the elderly vaccines that we give for the elderly.
Fascinating. So let's talk about schools, which right now are struggling across the country to stay open amid growing positive cases among students and staff. Nearly 1,000 cases were reported last week in New York City alone, forcing more than 400 classrooms to close. What kind of changes in protocol should schools consider to better protect students? I think that there's a sense here in New York City, especially, doctor, that because we have high vaccination rates, that we're in good shape. But then when you see a number like this, it does sort of give you pause.
Schools have to have a layered approach, and they've got to be flexible based on what's going on in the community in terms of transmission and what the level of transmission and vaccination is within their school population. I think schools should be very aggressive with promoting the vaccine, mandating it for teachers, and I think considering mandating it for school children as well. That's one way to make your school more resilient. I think they have to deploy testing in a strategic manner so that you don't have to quarantine an entire classroom, that you can test and then stay if you're negative, which has got a lot of data behind it. And then I think for the unvaccinated populations, especially in high-risk situations, it's really going to be important that they be masked. And I think this is all going to be something that changes throughout the school year, depending upon what's going on with transmission, how all the other types of layered protection activities are working. But it's going to be a difficult school year, but I think it can be done. It should be done. It should be a priority to keep kids in-person learning the entire time, because kids have suffered for so long because they were out of school.
All right, Dr. Adalja, very good to talk to you as always, my friend. Thank you very much.
Thank you.